afternoon, everyone. We're going to switch now to talk about the clinical landscape here and opportunities for collaboration within the department. Let me start again with just reminding everybody of the divisions that we have here in our department. You can see MFM, our hospitalist division, midwifery, our nurse practitioners, 21 generalists. We have GYN oncology, REI, OB-GYN, and family planning, and we're top ranked in the US for the services that we provide. In terms of our training programs, this is an amazing area where we gain a lot of ideas from our trainees. They're so smart and they're able to bring forward some really good thoughts about what we need to do to improve the care that we provide. We have 24 residents and then 3 fellows from each of the different specialties. However, following the legacy of Dr. Robert Resnick, who established our fellowship 30 years ago in 1975, we are going to grow our fellowship to have 2 fellows per year for a total of 6 per year. And same thing with urogynecology. They're going to be increasing their fellow complement. We are very, very excited about that. But I also wanted to just talk about how UCSD care and also some of our research, our OB registry in specific, reflects the population that we care for here in San Diego County. So just to orient you to this figure, you can see in the light blue that we have the San Diego County population demographics. And then in the middle blue, you have the UCSD clinical care population demographics. And in the darker blue is the OB registry that we maintain here at UCSD. And you can see that it very much mirrors the demographics of the population that we serve clinically, which is very, very important and something we aim to achieve, to have our population that we care for be reflected in the research that we produce. And now, where are we located in San Diego? We are everywhere providing OB and also GYN care. And so I've placed stars throughout San Diego County to kind of show you the reach that we have. As you guys know, UCSD Jacobs Medical Center is where our labor and delivery is, and it's housed here in La Jolla. But we also have fetal imaging and outpatient clinics in that La Jolla area. We then have our maternal fetal care and genetics, which we'll be talking a little bit about, that houses our fetal imaging, genetics, and outpatient clinics. And then now in Hillcrest, we have our older hospital, but also we have the new McGrath fetal imaging, which will be opening up and will be housing our future fetal surgery program. We have very specialized OB clinical programs here at UCSD. We have our diabetes and pregnancy program that really cares for women with pregestational diabetes, and most of the women with pregestational diabetes in San Diego County, as well as gestational diabetes, and offer state-of-the-art care. We have our high-risk obstetrical clinics, which provide comprehensive maternal care for maternal complications in pregnancy, as well as fetal complications. And we also have a new postpartum care clinic that is starting, and an HIV medicine a clinic that has long been standing. One of the things that I've failed to mention on here is a maternal mental health program, which offers maternal mental health support for our patients as well. With regards to obstetrical imaging here at UCSD, we really are cutting edge with regards to state-of-the-art fetal and placental imaging. We have our fetal and maternal care imaging center that cares for mothers as well as fetuses, obviously. And you can see here on the top right, this is one of our area of expertise, which is the placenta accreta program that we have here. And we are experts in diagnosing this, and we include collaborations with oncology as well as radiology for the care of our patients, which is a very complex condition to care for. But we also offer genetic services to be able to provide care for our mothers and fetuses with genetic abnormalities. We're hoping to open the fetal surgery program soon, later this year. And you can see on the right bottom hand is our partners, Dr. Amarua and Nan Chang, performing a fetal transfusion. And so hoping to be able to not only provide the service clinically for our county, instead of having our patients travel long distances for these services, but also for our trainees, and also a wealth of potential research collaborations that can be done through the center. I also wanted to just discuss some of the patient care conferences that are very collaborative here at UCSD. We have the Placenta Accreta Spectrum Conference. Again, it's attended by radiology, maternal fetal medicine, critical care, anesthesia, ICU services, our nursing staff. We have the cardio obstetrics population conference, which again, we welcome the collaboration from our cardiac specialists and also all of our colleagues that are necessary to provide the best care possible for our patients. We now have our rheumatologic conference, and starting this year, we'll be also adding inflammatory bowel disease conference. So as you can see, with regards to our clinical services, we provide a very collaborative environment to provide the best maternal care that we can. But we also have top-notch imaging for the patients who come into our center, and we're able to help them, and hopefully in the future with our fetal therapy center, help those fetuses to thrive. So we are well poised with regards to our clinical programs to not only collaborate clinically, but also with regards to your research. And we welcome your questions and your research ideas with regards to maternal health, placental health, and fetal health. And with that in mind, I'd like to introduce Dr. Louise Laurent, who will be talking a little bit about her work on the placenta.